I'll be presenting about my placement at Pinecrest-Queensway Community Health Center. My name is Tia Wong. I'm a fourth year BA Health and Community Services student like everybody else. I currently live and work in Ottawa, Ontario, traditional and unceded territory of the Algonquin Anishinaabe people. The land I know as Ottawa was never surrendered or sold to the Canadian state. Yet institutions of state power, such as our parliament buildings and even embassies of other nations, claim parts of this land. Meanwhile, Indigenous people are severely overrepresented in the city's homeless population. I'm really grateful to be a visitor on this land and to have learned so much on it, and I hope to use my knowledge and skills to improve the health and well being of Indigenous peoples across Turtle Island. In this first section, I'll introduce the organization I paired with and the work I completed for my placement. Pinecrest-Queensway is a community health center that serves over 45,000 individuals across 60 sites in Ottawa. They have about 350 employees spread across these sites, plus hundreds of volunteers. The organization's main site houses a primary care clinic, family services, and youth programs. Pinecrest-Queensway's programs aim to address the social determinants of health in their communities by fostering social cohesion, working towards food security, and improving education. They have programs like Pathways to Education, soup groups, collective kitchens, and ESL classes. Pinecrest-Queensway's off-site locations include 6 community houses, which are integrated into Ottawa community housing or low-income neighborhoods. Each community house has a coordinator that oversees all operations there. Through interviews with that staff, I determined their need for interprofessional communication strategies. Part of the reason staff struggle to communicate with the larger organization is that Pinecrest-Queensway does not require a formal evaluation process for their programs. So they also needed formal evaluation tools to facilitate interorganizational communication. The first gap I wanted to address as my practice scenario was communication. The coordinators of the community houses run similar programs in their neighborhoods, but they don't communicate about where they get grants, how they organize volunteers, or what programs they have going on. So my supervisor and I saw an opportunity to address this gap so that the coordinators could leverage their shared resources and collective impact. My supervisor also identified that staff at the Pinecrest-Queensway main site had little idea of what was going on at the community houses or how effective their programs were. So I sought to address this through an evaluation toolkit. The communication strategy includes tools such as workshops, activities and games, policies, and projects centered around the concept of collective impact, as well as the interprofessional competency framework. Collective impact is an approach to community change that emphasizes collaboration to enact changes to policies and larger systems. The evaluation toolkit explains what evaluation is, why it's important, and how Pinecrest-Queensway can take advantage of evaluation tools to improve their work. It focuses on storytelling as a tool of evaluation, which sheds light on program successes while also breaking down silos between departments. In this section, I'll discuss how the values, knowledge, and skills from the BA program informed my work at Pinecrest-Queensway. In creating a toolkit for evaluation, I kept in mind that the community members' voices must constantly be centered. Pinecrest-Queensway already does a great job of assets-based community development and capacity building. For example, when I visited the Pinecrest Terrace Community House, someone from the Internationally Trained Professionals program was helping the community house coordinator with balancing their budgets. The coordinator explained to me that rather than bring in an expert accountant from outside the community, she tries to bring in members of the neighborhood to do skills-based work to build capacity and enhance skills. I also explored community-based approaches by researching Most Significant Change, which is a monitoring tool that uses stories to deliver a rich picture of how the organization can change lives. Throughout my practicum, I was able to use and develop skills I learned through the BA program, such as interprofessional teamwork, written and oral communication, and cultural safety and competence. I used course materials such as the Canadian Interprofessional Health Collaborative's National Competency Framework. I conducted oral interviews, and I linked literature and cultural safety to my 2 documents. Cultural safety is one of the PHSP values and skills that I'm most interested in. My background and my personal interests are in anti oppression and anti racist practice, so I think it's really important to connect these concepts to healthcare and community services. Cultural safety is when service providers acknowledge and respect diverse cultures, exhibit cultural competence, and use a self reflective lens in all of their work. And this is just a quote. Organizations like Pinecrest-Queensway have good intentions. They want to lift up the community, build capacity, improve health outcomes, and maintain the dignity of their clients. However, having good intentions doesn't always mean that the best practices of cultural safety, social justice, and equity are actually in place. I asked staff at PQ about how cultural safety is employed there. They told me that the organization doesn't have a specific policy or procedure on cultural safety. They have general guidelines against racism and discrimination, like most workplaces, but employees don't receive training on this. The self reflection aspect that is so emphasized in the literature about cultural safety is not quite fulfilled by PQ. For example, I didn't see formal attention required towards the role that the organization holds in the power structure of their communities. That's not to say that individuals and teams don't take their power and privilege into account in their work, but it's not ingrained in the organizational culture. I included sections on cultural safety in the two documents I created. Overall, I'm really happy with how my practicum went. I learned a lot and it gave me a lot of confidence. One thing I would change is integrating that cultural safety aspect a little sooner in my practicum or making it my main attention. But I found it very valuable to have worked in a real healthcare environment, and getting to work with different people, interact with them through social programming was really eye opening. And it helped me see where I might fit into this field of work. Thanks for listening. Congratulations to everyone for completing their practicum placement and their degree. Thank you to the profs and my supervisor and my family and friends. And that's it. Oh, I have not been advancing my slides. There we go. Thank you.